morning. Thank you all for joining us. Last week, our government tabled Budget 2026, focused on what matters, making disciplined choices and taking decisive action. That means investing in the services that Albertans rely on when they need them the most. We know that too many Albertans are waiting longer than clinically recommended for surgeries and other essential health care. At the same time, population growth and aging demographics are increasing pressure on our acute care system. Budget 2026, if passed, responds with concrete strategic investments to strengthen Alberta's hospital and surgical system for the long term. This includes $13.8 billion to operate and expand acute care, an increase of approximately $1.7 billion over last year. These investments will support staffing, surgical activity, emergency services, diagnostics, major hospital upgrades, and more. Yesterday, we announced $59 million for a new cardiac cath lab in Lethbridge, along with critical care unit enhancements for Lethbridge and Medicine in southern Alberta. This is one example of that concrete investment in action. Another key initiative under the Acute Care Action Plan is the development of a 30-year provincial acute care workforce plan in partnership with Acute Care Alberta. This plan will identify current and future workforce priorities and outline the actions that are needed to strengthen the acute care sector across Alberta. It includes a comprehensive workforce forecast for all acute care professionals, a strategic action plan, and an implementation framework. To ensure the plan reflects system-wide expertise, we are seeking input from health professional regulatory bodies, post-secondary institutions, and key associations, including the AMA. By prioritizing both people and infrastructure, Alberta's government is building a stronger acute care system that delivers timely access and better outcomes for Albertans now and into the future. To expand capacity and ensure long-term sustainability, Budget 2026 would invest $1.4 billion in capital funding over the next 3 years. This includes over $300 million to strengthen rural and remote hospitals and $63 million to plan and develop shelled and vacant space, optimizing hospital capacity and patient flow. Examples of this work include $60 million for rural hospital enhancement, which supports evidence-based planning for rural hospital upgrades and replacements, ensuring our investments are going where they're needed most. Additional projects include developing shelled space in places like the Mazankowski Alberta Heart Institute in Edmonton, and even here at the Peter Lougheed potentially, as well as the renovation of vacated spaces at the Grey Nuns Hospital in Edmonton, QE2 Hospital in Grand Prairie, Tom Baker Centre in Calgary, and beyond. Recognizing the need to reduce surgical wait times, Budget 2026 would invest $586 million through the Acute Care Action Plan to deliver 50,000 additional procedures. Medical device reprocessing departments would also receive over $300 million in capital over 3 years to support faster and safer surgeries. This builds on the 330,000 procedures we expect to perform this year, which surpasses last year's record number of 318,000. These investments ensure Alberta's acute care system is strong, responsive, and ready to meet the needs of Albertans now and into the future. With that, I will now turn it over to Minister Horner. Thank you.
Thank you, Minister Jones. Good morning, everyone. And I should thank Minister Jones for your commitment to strengthening hospital and surgical care for patients across Alberta. When we talk about budgets, we often frame the conversation in numbers. Billions of dollars, percentages, plans measured in spreadsheets, but Albertans don't experience healthcare as numbers on a page. They experience it in moments, real moments, often on the hardest days of their lives. Hospitals are where certainty matters most. They're where parents wait through long nights for news about their sick child, where a worker injured on the job depends on a skilled surgical team to get them back on their feet, and where every sick Albertan has the opportunity for a second chance. That's why Budget 2026 is focused on what matters. Alberta has grown at a remarkable pace. Our population isn't just increasing, it is transforming the demands placed on every part of our system. More families choosing Alberta means more emergency visits, more surgeries, more complex care, and more pressure on the skilled professionals who show up every day to save lives and make a difference. Growth is a sign of confidence in our province, but growth also brings responsibility, because every Albertan deserves the care they need when they need it. Hospitals are more than just buildings, and surgical capacity is more than a metric. its mobility restored, pain relieved, and independence returned. It's people getting their lives back, their work, and their families. Through this investment, our government wants to give Albertans reassurance that no matter how quickly Alberta grows, our care will grow with it. At the heart of Budget 2026 is a focus not on abstract systems, but on people, on readiness, on ensuring Alberta remains a place where opportunity and security move forward together. Because a strong province is built on strong communities, and strong communities depend on hospitals that are ready when Albertans need them most. That's why, despite our challenging fiscal year ahead, Alberta's government remains steadfast in our commitment to investing in what matters most, quality care for Albertans. Thank you for the opportunity to be here today, and now it is my pleasure to welcome David Diamond, Interim CEO of Acute Care Alberta.
Thank you, Minister Horn, and good morning, everyone. As the Interim CEO of Acute Care Alberta, I'm pleased to be here to talk about what Budget 2026 means for acute care across the province now and in the years ahead. We're keenly aware that Albertans are waiting too long to access acute care. And whether it's in the emergency department, waiting rooms, in the hospital, waiting for placement to a long-term care or continuing care facility, or on a lengthy surgical wait list. Though we are working very closely with our partners in government and across the healthcare system to address these challenges, the reality is that it can be a very frustrating process to access the services that you need. Acute Care Alberta was created to help manage capacity and patient flow throughout the acute care system. Thanks to the 6.4% increase in the global hospital and surgical services budget this year, we will be able to take concrete action to reduce wait times, to improve access, and to expand capacity. Increases in subsequent years will also help us keep up with the demands of a growing population whose needs are increasingly more complex. The budget also includes $525 million over 3 years to complete the additional 50,000 surgeries. That's 50,000 surgeries above and beyond the approximately 321,000 surgeries that the minister talked about that were performed in our province last year. This increase in surgeries will not only help address long wait lists for common procedures, but will also help increase the number of patients who are being seen and treated within clinical guidelines, ultimately helping more Albertans get on the road to recovery. At the end of the day, this healthcare budget is about improving the quality of a life for our patients and for their families. The sooner patients can access the care they need, the sooner that they can get back to a happy life and fulfilling life. Helping Albertans live life to the fullest, free from pain and illness, is what motivates all of us at Acute Care Alberta. And it motivates us to be relentless in our pursuit of solutions to the challenges facing the system. I'd like to echo the gratitude that's already been expressed today for our frontline staff, our healthcare workers, our nurses and doctors, and others who work in our system and work tirelessly every day to care for Albertans where and when they need it. Thank you very much, and I will turn things over now to Kyle, who will moderate the Q&A.
Thank you, Mr. Diamond. That brings us to the end of the formal portion of our news conference. We'll now move to media question and answer portion. As a reminder to all reporters present or on the phone, please identify yourself, your outlet, and who you're directing the question to. We have time for one question and one follow-up, and we will start on the phones. Operator, can you put on the first reporter?
Your first question comes from the line of Shine Amato from City News. Please go ahead.
Thank you for taking our questions. Minister Horner, I'm just looking at the price of WTI. It's $76, $78, something like that. Way up again today. I've heard that some industry experts say it might get to $100, maybe even $150 a barrel. What are your latest projections telling you, and what is that going to mean for our budget here?
Well, I guess I would start by just saying, we still have a month left of the fiscal year we're in, of 25-26. So although the price is much higher than we forecast at Q3 for the year we're in, an extra month at elevated prices would probably have a dramatic impact. I don't want to speculate on how much that will change things for this year, but we know it will help. We know we're on the right side of it. When it comes to the price moving forward, I think that the market is slowly adding in risk to the system. It will depend a lot on how long this lasts. We stand by the fact that there's a lot of oil in the world. Once the risk comes out, it'll come back to supply and demand pretty quickly. So we think we had a reasonable forecast at $60.50, considering everything that we knew. Obviously, if it stays above that for a sustained period, it would help the books substantially. I would also just caution people that the higher it goes usually means the lower it goes later. The cure for high oil prices is high oil prices. It incentivizes production while deteriorating demand. But while we're on the right side of it, it's a good thing. I just would say nobody's cheering on war, wants to see silly loss of life. It does speak to the fact that we are very stable here in Canada. The Premier's been clear that her phone's been hot with country leaders in Europe and overseas, even more interested in our products and getting them to market. So I think we can answer some of that question for the world. I guess I just remind you of the sensitivities at that $60 range. It's about $680 million per dollar change in WTI. Last year, when we were in the 70 range, it was more like $750 million. So it is substantial, but 365 days in a year, it's a long year, so we'll have to wait and see what happens.
Sean, do you have a follow-up?
I do, on a completely different topic for Minister Jones, if I may. The NDP has put out a press release about the deadliest flu season on Alberta's record. 250 people have died so far. They say that the number of deaths is going up, the vaccination rate is going down in Alberta. So, Minister Jones, what do you think is the solution here? What can be done to sort of reverse these trends?
Thank you for the question. It was a particularly difficult respiratory virus season, and there was a mismatch in the vaccine that contributed to that difficulty. The government of Alberta engages in education and awareness campaigns about the benefits of vaccination, and I would encourage everybody watching here to consult with your doctor or medical professional about your options to get protected. The good news for Alberta is that we are through the worst of the respiratory virus season. We've got about 70% less patients hospitalized for respiratory viruses today than at peak in late December, where it was around 1,000. We're a little under 300 today. We've also seen pressures in our emergency departments and ICUs drop from around 100% utilization to mid-80s today. So lots of work to do. We can always do more to build awareness and educate Albertans on ways that they can protect themselves and others, and we'll continue to do so. And credit to the incredible teams at all our hospitals who really got the province and Albertans through the worst of respiratory virus season.
Thank you, Minister. Operator, can you put through the next caller, please?
And next question is from the line of Chris Warco from Cargill and Herald. Please go ahead.
Hi, this is a question for Minister Horner, and this is just a follow-up on the previous question. Minister, you talked about the impact of rising oil prices, but I also know that you do scenario planning, and some of that is laid out in the new budget that came out. I'm just wondering, if you do see oil prices substantively higher, like at $10 higher, what's the impact not just to the government revenues, but also to the economy?
Oh, that's a great question, Chris, and we'll probably have a more detailed summation of what we've seen at our annual report in the Q1. What you'll see, obviously, it'll be good for our books. It'll increase the cost of living as fuel goes up, and it'll lead to, if it's really an elevated price, it'll lead to an economic slowdown potentially globally. So it all depends how high it goes and how long it lasts, but we'll work through some of those scenarios at our next reporting period.
Chris, did you have a follow-up?
Yeah, just turning a little bit to the Alberta Heritage Fund. I know that obviously your government has said that it's going to leave revenue within there for the time being, but I'm wondering at what point would the government consider dipping into the Heritage Fund to actually bring the deficit down if you thought that was the right thing to do?
Well, I explained this, as I've been traveling around the province, I've been asked that question by many as we're explaining Budget 2026. When you look back at what our debt's costing us, weighted moving average over the last 5 years, it's below 4%. This may not be exact, but I would estimate around 3.7%. You look back at the 5-year average of the Heritage Fund, it's about 8.8. You have a 5% delta. I'm very focused on the net position of the province. So I believe that if we're to reach our goal of $250 billion by 2050 and have a substantial revenue resource for our kids and grandkids to deal with their, the most important problems of their day, that we'll need to be diligent and stick to the plan. And I think that's math I think Albertans will really appreciate.
Thanks, Minister. Operator, can you put through the next caller?
Your next question comes from the line of Janet French from CBC Edmonton. Please go ahead.
Good morning. Questions are for Minister Jones. Just referring to the Alberta Medical Association statement that came out yesterday following you and the Premier's comments about the triage liaison physician program. What's the point of your government having negotiated a way of navigating alternative relationship plans with doctors if you're not willing to follow that agreed-upon procedure?
Thank you for the question. So again, we have, and as mentioned by the AMA yesterday, we do have meetings planned to work through the triage liaison physician role. As you know, this role was recommended by the ED section of the AMA. It was implemented, and shortly thereafter, on January 30th, we received a counter-proposal letter which outlined 7 requests related to the position. The first 4 of those requests were all compensation related. They involved increases to base pay, overtime, after-hours modifiers, and then some liability, of which the Government of Alberta currently covers 80%. We're happy to work through those, although we can't work through them immediately. It does take time. We've already accepted the after-hours request, which was point number 3 in that letter. And I'm hoping in these subsequent meetings that we'll be able to work through the others. I think we all agree that this position will be beneficial to patients, so it's up to us and the AMA to work together to get it done.
Janet, did you have a follow-up?
Unfortunately, that doesn't address the nature of my question, which is that there's apparently this agreement from 2025, which was part of the negotiated settlement with doctors, where you have, not just for triage liaison physicians, but any kind of role that's going to be fulfilled through an ARP, there's a way of negotiating that ARP. So are you following that process, or do you now consider that negotiated approach to be a non-starter, non-existent?
We're working with the AMA, and we engage with them on a daily basis on matters of interest, including the triage liaison physician role, and we'll continue to do so. I also have meetings scheduled, which will include the AMA on operational issues that we can resolve together. I believe the first session is on March 20th in Edmonton. So both on the financial side, as it relates to the next AMA agreement and the triage liaison physician role, we have meetings planned to work through those issues. We also have meetings planned to work through the day-to-day operational issues, which are separate but very important.
Thank you, Minister. Operator, can you put through the next caller?
Your next question comes from the line of Lisa Johnson from Canadian Press. Please go ahead.
Hi, good morning. Thanks. This is also for Minister Jones, just to follow up on Janet's questions regarding the triage physicians. Generally, it is your responsibility to manage ERs in the province and make changes to how our systems operate. Is there a plan B if the triage physician positions are essentially at a standstill, we're in limbo with these? What is the plan B to address the extreme pressures in emergency rooms right now?
I'm optimistic that we will find a solution with the AMA, because I've met with ED physicians that would like to perform the role. I think there's a few, again, compensation and compensation structure issues to resolve, and then I'm optimistic that we can fill these roles. In the event that that were not the case, we would honor the intent. The intent is to support ED emergency departments and increase patient flow. We would look at nurse practitioners, triage nurses. We would look at providing perhaps global budget increases to emergency departments at key hospitals. So we certainly want to deliver the support that hospitals require, that that patients expect, and we're going to do so. I would like to continue to work with the AMA in good faith and try to get this done.
Lisa, did you have a follow-up?
Yeah, going back to the AMA's letter, there seems to be a bit of a blame game going on here. I mean, they say contrary to what was stated yesterday by you and the Premier, the delay in this, in implementing this rule has not been on the AMA's end and is not solely related to the compensation rate. So I'm wondering, I mean, at the end of the day, Albertans don't want to hear the blame game. So I'm not sure how this demonstrates good governance and problem solving on your end. Like, shouldn't you be solving this problem instead of blaming the AMA?
Yep, certainly not blaming the AMA. In fact, I met with the AMA. They recommended the position, and I implemented it and budgeted $20 million over 2 years to implement it at up to 9 hospitals in Alberta. When the counter proposal was sent by the AMA on January 30th, we immediately started to evaluate those and agreed to point number 2, which was the after-hours modifier. Again, the other compensation requests were around an increase to base pay, overtime, and enhanced liability. And perhaps the AMA can share that letter that they sent on January 30th so you can understand the context. We continue to work through those requests by the AMA, and there are meetings being scheduled to do just that. And again, I'm optimistic we can find a solution. There's 2 sides to this, and I take accountability for our side of it. We did implement the position. We did accept the after-hours modifier. We have looked into the concerns over liability, and we'll continue to work with the AMA on each of these points. And I would also ask that they continue to work with us to get it done for patients.
Thank you, Minister. Operator, can you put through the next caller?
Your next question is from the line of Jack Farrell from the Canadian Press. Please go ahead.
Hey, also for Minister Jones, same topic. I'm just wondering if you think, if we're going to go through negotiations, is there a chance that triage physicians aren't in place until they're maybe no longer needed?
I think they are needed. And again, if physicians, if we can come to terms with physicians in the near term, we would look at leveraging nurse practitioners, triage nurses, or providing global budget increases to emergency departments so that they can address any staffing or other financial pain points that they're dealing with. Again, I'm optimistic that we can come to a resolution and implement this position. That is certainly my preference. That's certainly what my team has been directed to do. So I hope that the upcoming meetings with the AMA in March here will be productive.
Jack, did you have a follow-up?
Yeah. Do you have a sense of how quickly the government would be able to act on that Plan B with nurse practitioners and you said budget increases for emergency rooms? Like, is that something you can mobilize in a week's time, or how long does that take to kind of put into place too?
Budgetary increases could be done immediately. Nurse practitioners with emergency department experience are not as common, so that might take time. Enhancing nursing supports, that could be done very quickly, and there are some other options that we are looking at. Again, I'm not looking for ways to not implement the triage liaison physician role. I'm looking for ways to implement it. So first and foremost, I would like the teams to get together with the AMA and try to resolve these outstanding issues, and then get emerge docs supporting patients in the waiting room.
Thank you, Minister. Operator, can you put through the next caller?
Your next question is from the line of Catherine Grukowski from All Alberta. Please go ahead.
Thanks. So first question also to Matt Jones. So again, on this AMA statement, they said for many weeks it's been difficult to advance discussions or reach decisions, as it was unclear among government ministries and agencies where the responsibilities and accountabilities lay for the rates and conditions supporting the TLP. So why is it that it took weeks for you to stand here and say, I'm accountable? Like, why is there this unclear communication?
I don't think that's the case at all. I think I met with the AMA in the fall. They recommended a position which was implemented very quickly. And then on January 30th, we received a counter-proposal letter from the ED section of the AMA with 7 requests. Again, those were compensation and compensation structure related, increases to base pay, after-hours modifiers, overtime, and enhanced liability coverage or higher base rates. As you can appreciate, these are changes to compensation structure that would be also evaluated by other healthcare workers, other groups of physicians. We are also entering broad agreement negotiations with the AMA. So receiving that counter proposal on January 30th, we immediately started working through that. We can't do that instantaneously. And it was unfortunate that the ED section then recommended that their members not accept this role until these 7 points were implemented or found some level of resolution there. Again, we have meetings scheduled to work through these outstanding issues, and I'm optimistic that we can do so.
Catherine, do you have a follow-up?
Sure. So, unrelated question. I'll jump to Minister Horner. You had mentioned war and the death and suffering that comes along with oil prices. And I remember when Russia invaded Ukraine, we welcomed Ukrainians who are fleeing war. They were not coming here permanently. They're hoping to go back home. And I wonder, when we talk about the people who are fleeing this latest violence in the Middle East, what room is there in the budget for those who are fleeing war, as we're seeing a spike as a result of this conflict?
Well, I think the Prime Minister's given some comments recently in that regard. You know, the federal government's definitely tightened up on population growth in this country dramatically. But I would allow him to comment, and then we'll use the levers that we have to ensure that the people coming to Alberta are, you know, economic immigrants that are filling the roles that we need for a growing province. That's always been the goal.
Thank you, Minister. Operator, can you put through the next caller?
We don't have any further questions over the phone lines. Thank you.
Thank you. Is there any questions in the room?
It's Kevin from Global. I just have a question for either minister, maybe one can answer and the other one can, regarding your thoughts on if Alberta should ditch daylight savings time as well.
You want that one, Matt? I know the Premier has mused that we will likely consider it after BC said that they're going to change one more time and then never again. But I think we better wait till we hear all the facts. I know there was a little issue the last time we asked the question. Albertans really wanted to understand which time we were going to change to and why. So I think we'll have to have that conversation and really go through the rationale, but it's probably coming toward us.
Kevin, did you have a follow-up?
I have no opinion or preference.
Well, seeing there's no other questions on the line, thank you, everyone. That concludes the time we have available today. If you have any additional questions or follow-up, please feel free to reach out.
Thank you, everyone.